Hi and welcome back. It must be Wednesday here at San Antonio Cosmetic Surgery. I'm here with Cynthia. I'm Dr. Baumholtz. Welcome. Our phone number 210-614-4320. Like, share, and comment as we do today's special broadcast. We have a super special guest today for the procedure we're going to show you. And we're going to teach you some things, and we're going to talk about hands. So one of the last places a woman can show her age or hide her age is the back of her hands. So we can wear makeup, we can do all sorts of things, and over time the hands change, and there are some characteristic changes that I'm going to show you here in just a second. So we see the veins are more prominent, and the spaces, we call them the intermetacarpal spaces, between the fingers become more shallow or hollow, and there's the depressions. And now, because we have this very special guest, I'm going to hold the camera for just a second, and I'm going to put a hand right next to this hand. So go ahead and put your hand right next to it. So what we see here is we actually have mother and daughter. I don't often get that, but here's mother and daughter. So mother and daughter.
Hi.
Hi. Say hello. Hi. And we can see the quality and texture of the skin changes over time. And so we want to address some of the spaces here. Mom wants to address some of the spaces here. And we have an awesome product to do that. And I'm going to show you a little about it in just a second. So I'm going to hand this back to our photographer, and I'm going to get us all ready to do today's procedure.
And our model today, who is my mom, and by the way, it's me, Genevieve, the practice administrator here at San Antonio Cosmetic Surgery, and this is my lovely mother. Her hands are, how old, Mom?
68.
68. And my hands are 40-something.
24.
40-something. But anyhow, just so you have an idea of, I'm probably going to be doing this soon. My hands seem to have aged much faster than the rest of me. It can happen at any age, but going back to the procedure, here are my mom's hands again. You will see once we get started.
Yep. So we're going to get started in just a quick second. Give me 1 second while I add the magic sauce. Okay, so here's what we're going to do. So the first thing is the patient will come in, I have them wash their hands thoroughly, and then what we're going to do is we'll start with this hand, and I'm going to use alcohol. It's cheap, so we're going to use a lot of it, and we're really going to make sure that the hand and skin is clean. Now, some precautions. After the procedure, no heavy activity, no rings, no jewelry for 24 hours. The way this goes, it's going to be rather quick, but really very, very easy. Okay, so here we go. I'm going to get some dry gauze next, please. Yep, I'll get that.
And what type of filler are you using, Dr. Baumholtz?
This is Radiesse.
Radiesse.
And Radiesse is, wait, I'm just going to get a little dry gauze, dry off some of this. Now, is the lighting better with the light on or off? Tell me. So some sterile gauze, and so we're going to begin. Now, if this table, does this table move at all, or here we are? Okay, it'll just shine off my bald head. All right, so what we're going to do is we're going to start in the intermetacarpal spaces, and I'm going to start a little more to the back of the hand or to the wrist side, and we're going to put the filler in. I'm going to put about 0.4 mLs in each space, and you'll see me reload as we go. So here we are. So here I'm going to lift up the skin, right? I'm going to pinch the skin, and I'm going to shake a little bit like when we go to the dentist, and I'm going to come in. Did that hurt at all, dear?
No.
No? Okay, and so I'm going to put in 0.4, right? So here we go. I'm going to move it, and I'm going to make sure my needle is not in a vein or anything, and I'm going to put this in, and it goes. It's tough stuff, so we go. There's 0.4 like that, and then I'm going to move one finger over, and I'm going to pinch the skin. I'm going to go in, just like that. And again, I'm going to move the needle, make sure everything's okay. So this is going to take me down to 0.7.
Is there any numbing required prior to this?
No, prior to this, but I actually have numbing medicine mixed in with the product. That's one of the nice things of this particular product. So we're going down to 0.3. Okay, just about there. And now I'm going to reload because I mix up a little bit extra thanks to my numbing medicine. There should be just a little bit left in this, and there is. So I'm going to transfer this back over, and we're going to use every last little drop.
She don't want to watch.
Okay, so there, 1, 2, and now I'm going to come into this space as well.
Are you having any discomfort?
No.
Am I hurting it all, dear? Okay.
Patient's doing really well, tolerating it very well. Like he says, he used a little bit of lidocaine in the product, which helps when he injects.
Great, perfect.
Right?
So now, she's a little extra deficient here, so I'm going to put just a little more forward to this. Now I see the vein crossing, and I'm going to avoid that. I'm going to put just a little touch here, and I'm going to come over, same thing. Again, I'm going to try to avoid that vein, And there, now we're done. Now, here's the magic of what we're gonna do. So, I'm not gonna do anything else to her right now. I'm gonna wrap this hand up in a towel, and I'm gonna have her sit on it.
Go.
So patient participation time.
There you go.
There we go, perfect, okay. So there, did anybody blink? We just did one hand, now we're gonna move this one over. So if we've got questions as we go, people can just ask. So we've got our medicine mixed with the numbing medicine. Did that hurt you at all, dear?
No.
Okay. What questions do you have as we go? Because you'll ask us questions.
Well, I think you answered them. You said I don't lift nothing heavy or
Nope.
nothing.
Nope.
Will the hands be sore after this?
There's the potential to be sore, but not terribly so. There can be some swelling, which is why we ask you not to wear your rings. So again,
Can I get my hands wet?
you can get your hands wet, yes, ma'am. So again, we're going to start here. We're going to march our way over, but I like to start where it's most efficient. So here's the index. We call this the ray, and so here's the first space. There's a vein, and so we're going to try to strategically land in between them, right like that. And then I'm going to move the needle, make sure I'm where I want to be. And so I'm going to put in, again, my 0.4. You see it blows up, but that's okay. I'm going to move over a space, and I'm going to lift up, and I'm going to put it in. I'm going to make sure the needle moves. So I'm not in a tendon. I'm not in any place I don't want to be. And I'm going to fill this up, and then I'm going to move over. Again, big vein. I'm going to try to miss that if I can. Usually on camera, I tend to nail those kinds of things, but so
Thank you,
far,
Dr.
so good.
B. We
Yes.
appreciate that.
Yeah, that's good. Okay. And if you did, you would just put some pressure. Now I'm going to reload because I have a little bit extra thanks to the numbing medicine and the product. And again, these are the guidelines for how to mix it up, but different practices can do however they like. We like to put it with some numbing medicine so our patients are comfortable. Okay, so now we'll come over. We've got a little bit over here. We're going to put in just a touch over here, and then we're going to work our way back. Yep. Yep.
Don't forget to like, share, or comment on our page. Any questions, again, we'll have a drawing after today. We'll do it tomorrow at noon like we always do on our nice little filler for the hands. But
Okay, so
remember,
a towel.
ask any questions you may have, any concerns you may
Grab a
be
towel.
thinking about. If you can hand me the towel, please. We'd appreciate it.
All right.
Perfect timing, 210-614-4320, or just hit the like button. Ask any questions as we're live.
Nice
Got
of it.
Dr. B here for a few minutes to answer any questions, or myself.
All right, so now we're going to let that sit for just a second. And the next thing I need, can I have a little ointment or some kind of moisturizing cream?
How are you
Ointment
feeling?
Cream.
Fine. Fine, thank
Does
you.
it hurt at all?
No, no ma'am.
How long will she sit on her hands, Dr. B?
Until I have a little lotion in my hands, and then we're in business. Here we go. This will work out
Awesome.
just fine. Okay, bring your hand back to me, dear.
And
We'll
again,
start with this one.
if you like, share, comment, ask questions, call and make an appointment. This will make you eligible for our drawing tomorrow, which is going to be credit towards our spa if you're interested in getting this procedure done or any other that we offer. We offer all kinds of procedures here at San Antonio Cosmetic Surgery. We have a lovely med spa for facials, laser hair removal, and laser genesis, which we'll be featuring next week on our live stream. That laser genesis can be best explained by Amy, our esthetician, who happened to walk in the room. Hi, Amy.
Hi, how are you doing? Amy here. So next Wednesday, tune in. We are going to unlock beauty's secret. Laser Genesis helps diffuse redness, any kind of vascular redness of the face, control rosacea. It also helps minimize pores, fine lines, rejuvenate the skin, and activate collagen repair.
Okay, so what I want to show is here we've just massaged the product. These are her knuckles. They're not, someone asked if that was the product. These are actually her knuckles, so go ahead and make a fist for me. And so one of the questions we get is how much do we need? Well, we start with 1 syringe per side, and I let the patient sort of live with it for a little bit, and then some folks need more than 1, some need multiple, but we do 1 at a time, and they come back and they live with it, and they say, well, I like it, but I'd like a little more, and you'd come back and we do it again. All right, trade out this hand. I'm gonna give you back this for just a second. You don't have to sit on it, but just set it right there, and let's see this one. Thank you so much. And so you can really use any kind of ointment you like, but we're going to put a little ointment on, and now we're going to just massage this. And I started by injecting it in the back of the hand, and so I'm going to massage it forward to fill in the spaces. And we're just going to go back and forth. You can use anything you like.
Does that hurt?
No,
No.
not at all.
I have a gentle touch, thank you.
Of course you do. You're a plastic surgeon.
So, you're doing all right, dear?
Yes.
Okay, now, in just a minute, I'm going to let go, and then I'm going to have you bring your other hand back up, and we'll compare. Obviously, the veins are still here. And I'm just moving the product around. And so if we needed, this is a good size vein. If we needed to put more to make that disappear, we would. But there we are. Now let me.
Ideally, how many syringes does a
just-
hand of this
I think
preference?
I think it's preference. I suspect she might need one more before all is said and done, but it really will depend. I'd like to see her back in a week or two, and she'll tell me what she likes once it's all settled. Okay, just massaging this last little bit. I like how that looks. Okay, great. Okay, let's bring your hands up again.
Give me your hand.
I'll take
There
your
we
other
go.
hand. There we are. Okay, and so tell me your thoughts. Is it snake oil, or are you starting to see a change already?
Oh, yes, I see the change already.
You see your hands every day, so you can notice. We'll definitely post her before and after pictures of her hands for you guys to see
I'm
after
going to
this.
steal this for 1 second. Hi, everybody. I'm going to take this now. If you'll turn the light off for me, just take it away for just a second. There we are. Okay, forgive the camera moving. So we've got that one and that one. So when are you going to have your hands done next?
Probably very soon.
Okay, there we are. All right, everybody. I'm going to hand that back. Thank you all for joining us this lovely Wednesday afternoon. Let's get the whole team in. So Amy's going to guide us through next week's presentation. Looking forward to that. Cynthia, our nurse injector, our expert nurse injector, is here every day.
Monday through Friday.
To do these kinds of things.
Definitely.
Or if you're unlucky and you're stuck with me, or my partner, Dr. Erdogan, who couldn't be with us today because he's out there in surgery. But again, thank you for visiting our page, and thanks for learning with us, and you all have a great Wednesday and rest of the week.
Don't forget to like us on Facebook.
Comment, yes, and tune in. We are gonna unlock the beauty secret of the Genesis next Wednesday at noon sharp.
And tomorrow, our drawing at 12 noon again. Join us so you can get your name in there. We'll draw a name again, and you'll be lucky enough to come into our office and meet us all. Thank you so much.
Bye.
See you next Wednesday.
Bye.
See you.
Bye-bye.
Bye.